I'm Gary Smith. I'm the director of the Center for Injury Research and Policy at Nationwide Children's Hospital in Columbus, Ohio. The mission for the Center for Injury Research and Policy at Nationwide Children's Hospital is to investigate and prevent injuries to children and adolescents. We did a study recently on boxing injuries among all age groups, but with a focus on youth. Although there is risk of injury with most sports, boxing is unique because you're rewarded for striking your opponent about the head and face with the intent to do harm or to incapacitate them. This is the first nationally representative study done in the United States on boxing injuries treated in hospital emergency departments. The study looked at data over a 19-year period, and we found that over the 19-year study period there was a significant increase in the number of boxing injuries. 8,700 children are injured each year in this country related to boxing and are rushed to emergency departments. That's one every hour. The leading type of injury was a fracture. The most common body region injured were the hands and also the head and face. The most concerning finding of this study was that the proportion of injuries that involved concussions or closed head injury was identical among the younger boxers as well as older boxers. We expected that the younger boxers, because their punches had less force, would have a smaller proportion of concussions and head injuries, but in fact that wasn't true. The reason this is concerning is because repeated concussive and subconcussive blows to the head over a lifetime can lead to serious brain injury, known as chronic traumatic encephalopathy. These are the types of injuries that we want to prevent, especially among youth. We found in this study that the number of boxing injuries is increasing, and that combined with the fact that we found a large proportion of concussions and closed head injuries among young boxers leads us to support the position of the American Academy of Pediatrics, which is to oppose boxing for children, adolescents, and young adults.